Picture this. You're at a park and you see a child with Down syndrome. You notice that they are having a hard time keeping up with the other kids, and as a result, they play alone. As a therapist, you see an opportunity to help this child overcome the obstacles caused by their condition. How, you may ask? With virtual reality therapy.
We have 3 learning objectives for the following presentation. 1. Describe how Nintendo Wii can be used as an effective VR treatment therapy. 2. Explain the outcomes of the research study and the impact Wii had on motor abilities. And 3. List any limitations of this study.
First, let's discuss what is Down syndrome. Down syndrome is a genetic condition where someone is born with an extra chromosome. This can affect the way that person's brain and body develop, which causes developmental delays, and this can greatly affect their functional performance in everyday life. The characteristics of Down syndrome include low muscle tone and loose joints, which can affect this individual's strength and endurance, relatively short limbs, small hands and fingers, which greatly affects their coordination, especially in fine motor activities, and mild to moderate intellectual disabilities.
Virtual reality is when a computer system uses 3D visual effects or even some sensory effects in order to create an artificial environment. This allows the environment to be explored and experienced in a safe way while making the participant feel very engrossed in this environment. There are a variety of systems that use virtual reality, like PlayStation, Xbox, Oculus, and so many more. All these systems take on a unique experience by how they create their virtual reality and their artificial environment, which we have now just discovered we may use towards therapy by putting children in an environment that is safe and we can monitor while making them feel engrossed and an active participant within this environment. As we discussed, virtual reality has a multitude of applications. When we look at the Wii system and how the Wii system uses virtual reality, we looked at research and found that Wii VR falls into 3 main categories for occupational therapists. One is it is used as an at-home program they can take home after their therapy session with you, the OT. This, they discovered, increases functional mobility, trunk strength, muscular endurance, and so much more when it is used as an at-home program. The second use is as an actual therapy intervention. Something like Wii Fit focuses on balance, body weight decreased, functional mobility, again, increased, muscular strength, endurance, and positively correlated to their actual engagement. They were having fun. Then the third category of our research that we discovered that VR falls into is your warm-up, something that is fun and engaging, which we found that it increased not only hand dexterity, movement, but also participation and excitement for the therapy session. So no matter which avenue you take in using virtual reality in the Wii system during your therapy, either as the warm-up, the actual intervention, or that take-home, at-home OT program, it is very useful and showed huge strides in the community and all the benefits it has for our patients.
So we followed a study from Brazil where the researchers assessed the effectiveness of VR therapy on the motor development and postural control in children with Down syndrome. In the study, there was a total of 16 participants ages 6 through 12 years old. All of the participants were diagnosed with Down syndrome and were those who could comply with an intervention program. During the intervention, the experimental group, the ones who received the VR therapy, completed 5 weeks of intervention, 2 days a week for 20-minute sessions. And in each one of these sessions, they utilized the Wii Balance Board and the Wii Fit software. The instruments used within the study were the test of gross motor development, to identify the deficits in gross motor development in the children, as well as the Wii Balance Board, which used the Romberg Lab software to evaluate postural control.
The Wii games used in this study were Super Hula Hoop, Penguin Slide, Heading Soccer, Snowboard, and Ski Jumping.
So let's briefly take a look at one of the many games that Wii has to offer. In this game, the child with Down syndrome is standing on a balance board. The objective of the game is for the child to hit the oncoming soccer balls with his head in order to score points. In order for the child to move the head towards the target, or the ball, the child must shift weight on the balance board, thus encouraging postural control and movement. As you can see, the little kid is having a blast completing the exercise, whereas this could be difficult to achieve in another setting or when performing a different activity.
Why should OTs use Wii? Well, Wii is very engaging. Children are more likely to participate in a program that they find engaging and meaningful than an at-home exercise program that seems boring and feels like a chore. Wii gives you a score, is very interactive, it provides a lot of sensory input. Wii Fit is also built with exercise in mind, so the games are going to provide motor challenges, balance challenges, all things that will help this population. So what skills are taught through Wii? Postural control, especially when the balance board is used, motor development, including locomotor skills, which includes walking, running, jumping, crawling, skills of that nature, object control, they're using the remote to control objects through space within the video game, and the child also receives motor and sensory stimuli.
Before we conclude, I want to briefly touch on a few limitations as it pertains to our intervention and research. First off, this study used a convenience sample, so therefore it must be used in conjunction with other studies. Additionally, the things needed for this intervention, such as Nintendo Wii, balance board, TV monitor, those things can be quite expensive, making this treatment not practical for some. And lastly, more than 1 hour a day of screen time is associated with lower psychological well-being in children. So it is important that this intervention is well regulated and balanced with other activities such as playing outdoors and spending time with friends.
As we conclude our research, we can surmise that virtual reality therapy is largely beneficial to children with Down syndrome. When you look at virtual reality as an intervention, it increases their motor integration, engagement, and function. It also helps with their stabilization, coordination, and just helps with their functional mobility overall so they can do tasks. When you look at it as an occupation, what they're doing in virtual reality can be very applicable to them, something that's important, and something that's meaningful to them, so they feel like it's worth doing. Then there's also the dynamic systems approach. They are getting that motor input, that sensory integration, and that visual stimulation, all through virtual reality. They are completely immersed in the experience and in therapy, so they are at maximum engagement. And it's also very versatile. You can use it in a variety of settings, and you could also use it in a variety of ways, either as a preparatory activity, the intervention itself, a cool-down activity, or an at-home program. So virtual reality can really be applicable to anyone, anywhere, in any activity you want. So we are very excited to see what future research will come with virtual reality as virtual reality is on the rise. But we are excited now that it is hugely beneficial and can't wait to see all the amazing changes that we see in therapy in regards to virtual reality.
Thank you for coming to our TED Talk.